Hello friends, welcome to Cortex YouTube channel. In this video, I am going to discuss a clinical case scenario. A middle-aged male presents to your emergency department with several hours of confusion. Okay, there is a confusion. En route to the hospital, he has a self-terminating tonic-clonic seizures. He has no previous history of seizures. Okay, an urgent CT is done and it is given below. So let's interpret the CT. Look at this CT. This is right side. This is left side. Right side and left side, right side and left side. See what happened. This is the midline, so there is no midline shift. Look at this. Obviously this is skull. These are two cerebral hemispheres, right hemisphere, left hemisphere. Look at this. This is okay. Let me orient you here to the city finding. This is frontal lobe, this is occipital lobe. Okay, in the occipital lobe you are finding there is a hyperdense lesion. This lesion is white in color, so this is hyperdense. Okay, where is the lesion site? Site is posterior, left posterior occipital lobe. It is intraparenchymal. Intraparenchymal means inside the parenchyma of cerebral hemisphere. What it is hyperdense area, hyperdense lesion. So hyperdense lesion in a CT is bleed, so it is a bleed. With what happened, see, look at this. There is surrounding hypodense area. Look at this, is very clear here. Surrounding hypodense area. So hyperdense area with surrounding hypodense area, that means hyperdense area with surrounding hypodense area means this hypodense area can be explained by edema. So there is hypodense area. So this is the interpretation. Size and all they have not given. Obviously it is more than 2 centimeter. So this is suggestive of edema. So this is a bleed. Now question comes, whenever you are interpreting a bleed in a CT scan, you have to ask whether it is a primary bleed or secondary bleed. How to differentiate primary bleed from secondary bleed? See, primary bleed is almost always due to hypertension and amyloid angiopathy, while secondary bleed is because of underlying structural lesions like tumor, metastasis, METs, or ischemic stroke to transformation of ischemic stroke to hemorrhagic one, or other abnormal conditions. Okay, so secondary hemorrhage is because of other underlying structural lesions or like venous thrombosis, okay, etc. So these are the causes of primary and secondary hemorrhage. But how to differentiate on CT? The two important clinical clues or radiological clues comes in handy. Those are, one is the shape of the hemorrhage, shape, and edema, vasogenic edema. In primary hemorrhage, shape is irregular. In secondary hemorrhage, it is round. Edema is minimum or no edema. No edema in primary hemorrhage. Edema, vasogenic edema is present in secondary hemorrhage. Let me show you the pictures here. Look at this. This is, see, there is a hyperdense lesion here also, there is a hyperdense lesion here also. What happened here? This hyperdense area is not surrounded by hypodense area. That means there is no edema, significant edema. But look at this hyperdense area. It is surrounded by this hypodense area, that is edema. Why there is edema in secondary edema? Because there is a structural underlying lesion which is sufficient enough to cause breakdown of leakage from blood-brain barrier. There is a breakdown of blood-brain barrier. From there, capillaries leaks and causes surrounding edema. But in primary hemorrhage, there is no breakdown of blood-brain barrier. Okay, that's why there is no leakage in the primary hemorrhage. So this is primary hemorrhage, maybe because of hypertension in this case. Sorry, in this case it is secondary hemorrhage. It is because of uh, mass. When we evaluated this case, he was found to have colon cancer and metastasis to the cerebrum. Okay, hope you find this video informative. Please like, share, and subscribe. Thank you.